Aloha mai kako, aloha. So, aloha to all who've come over from whether it's Ocean View here in Naalehu and some who've come from Pahala. Just wanted to say aloha. Thank you for for being here. Last night we were at Yano Hall. Tonight here in Naalehu. Of course, tomorrow we honor our veterans on the 11th minute of the 11th hour of the 11th day on the 11th month. So we're taking a break tomorrow to honor all those who served our country. On Thursday, we will be in Konawaina again because I concerned a lot of it on West Hawaii here to talk about dengue. Friday we'll be in Honoka'a. I know on Monday and Tuesday of next week we'll be in Hilo and in Puna. So mahalo everybody for coming. Just like with any issue, whether we have a threat of tsunami or hurricanes, lava flows here on the island of Hawaii, we want to make sure that we get into the community, provide information, answer any questions that any of you have, and give you accurate, timely, up-to-date scoops. So bottom line, we are here in the County of Hawaii working cooperatively and collaboratively with our Department of Health, who are very appreciative for what they're doing thus far. I know there's a lot of concern, a lot of uncertainty. When we hear about a mosquito that can bite, we're gonna get sick. You know, when does a mosquito, how does it get transferred? What is the latest information we have? How do we prevent this spread from occurring? How do we protect ourselves? How do we protect our family? How do we keep our community a healthy, safe place to be? That's what tonight's meeting is about. We'll still here answer anybody's questions that we have. First, we'll listen to the really smart people. They just give me the mic first because I'm a mayor, you know what I mean? But I always ask the questions, right? The minute something go on, because if I don't understand them, certainly other people are going to have a hard time understand. But as soon as we became aware, first thing we did is I called somebody who I'm very appreciative to have on a team. He's done an excellent job, first as fire chief, and now as our director of civil defense, and that's Daryl Oliveira. I'd like to call up Daryl for a second. Thank you, Daryl. So as soon as I was like, hey, what's happening? What's going on? This not going away? Hey, Daryl, we've got to move. I'd like to introduce people who are here who will be talking as well. From the Department of Health, Hawaii Island. He handles DOH for Hawaii Island, also in charge of vector control. So when we talk dengue, it's right up his alley. He's got a team of 14. They get the reports. They're out there. They're spraying. They're monitoring. They're checking. Mr. Aaron Ueno. Thank you, Aaron, for being here. I know I get my DOH guys over here, but and you see two brothers in their Aloha shirt. They work for DOH too. They're the public education guys. Now I get Paul back there, Strauss, and Jason. Yeah, De La Cruz. Oh, so Naalehu named that De La Cruz. Big family they get down here. No, Jason De La Cruz, he works Department of Health, Public Information. Yeah, you know that De La Cruz, big family down there. No, I'm just kidding. Behind him is Paul Strauss. He's back there, active living. He's active advisory DOH. To the left of Paul is the warrior, flown in from Maui. You guys might have, he looked familiar. You might have seen him on the news. Dr. Lauren Pang out of Maui. So when they had the outbreak on dengue, many years, they shut down parks for months at a time. So he's flown in, Department of Health. So he's here. He'll be talking story with us. Thank you, Dr. Pang. Next to him is not a politician, is a representative from this area, Dr. Richard Cregan. He go and spray on the back of his truck. I told people, you guys need somebody come to your house, spray mosquitoes, call him up. Right there. I also see our councilman from the Puna area, Mr. Councilman Gregor Ilagan. Hello, Gregor. So like we said, as soon as we found out, or we were briefed by the Department of Health, our first thing is, where's the threat? What's going on? How do we address it? how much personnel do we need, how much resources do we need. At the county level, first thing we did is stand up our Emergency Operations Center, get our key agencies immediately to the table, EMS, fire department, so we can monitor and track medical reports, medical calls, get our Parks and Recreation immediately there, any of our parks, anywhere on island that we need to monitor, Public Works, how many trucks we got, how many sprayers, how many certified employees do we have, police, civil defense. So everybody was brought to the table in coordination with Department of Health. So what you won't hear is, oh, we don't have enough people, we don't have enough resources, we don't have the experience or expertise. But what we're also here to ask is that government, state, county can work cooperatively together, collaboratively, share information, move resources, but without the community's commitment, and help and participation and partnership, we cannot be successful. So the first thing I do as mayor, when we have a challenge, call the best we have, Darryl Oliveira, and I'll turn over the mic to him now. So ladies and gentlemen, your Civil Defense Chief, Darryl Oliveira.
Well, good evening, and again, thank you for coming out and allowing us the opportunity to share some information with you. And as the mayor said, probably the biggest message we ask you to walk away with is we need your help. We need everybody's help with this particular issue. As the mayor opened up, one of our responsibilities is to work closely with the subject matter experts when something is happening, any kind of threat to our island. Whether it's a weather event like a hurricane, we work closely with the Weather Service. If it's a tsunami, we're working with Pacific Tsunami Warning Center. And in this case, if it's a health issue or health outbreak issue, we're working closely with Department of Health. So we've been connected from the get-go on this particular incident, working closely together with what they've been trying to do is identify the prevalence or how the spread and how this got started here, and then how we're going to work together to get rid of it. And again, we definitely need the community's help. One of our roles and responsibilities to you is to keep you informed of what's happening. So as we get information, we provide it to you. And we know that for the people in this community out here, you're kind of at a loss. There's no public radio stations that you can get information over the radio, very limited access to information. And with that, I would say if you have ideas on how we can improve and work better with you to get information to you, please let us know. We've worked closely with the schools, the complex area superintendent for this area. We worked closely with he and his team to try to use the school system as a means of getting information out, but that doesn't reach everybody. So again, if you have ideas, whether you belong to a community group, an association, a subdivision association, please see me after this, and if there's a way we can dial you in and take advantage of your informal communication systems, we'd like to include you and integrate you into our system so that we can get information flowing better to the Ka'u community. Again, we know you're at a loss for some community, commercial infrastructure and how we can get information out here. And through you coming tonight, we're asking you to take the information with you, go back home, share it with family and friends, and help us continue to pass the word along. The other role and response we play is with coordinating the response to the threats and how we're going to deal with it. So as Department of Health has identified some key strategies on how we can work together to eliminate the dengue fever, got with the support of the mayor, additional personnel being trained. Today and Thursday, we have County Parks and Rec and County Public Works personnel being trained to supplement the teams from Department of Health to do additional spraying. As you heard, and if you did hear the radio message today, they were doing some spraying out here in the Naalehu area, and we'd like to continue that effort as a means of trying to eradicate the mosquitoes that are the transporter or transmission mechanism for the dengue virus. So we're looking at building capacity using county resources to support Department of Health. The mayor has also supported us with buying equipment. If we need additional spraying equipment, aside from what's available in the state, we will procure that equipment and make it available to support a very aggressive eradication effort on the part of everybody working together. And then the other parts of that is the ability to reach out upwards. So we've been talking to state civil defense, so the Hawaii Emergency Management Organization. What other resources can we get a hold of? One of the shortages we identified early on was mosquito repellent. You're all being told, fight the bite, do what you can to prevent being bitten, prevent your exposure. And one of the recommendations is to use mosquito repellent. Well, some of the merchants are running out of stock, so we're working with them to see how we can help them expedite their shipments, whether it be moving resources from another store elsewhere in the state to stores here, as well as reaching out and asking if the National Guard or even the CDC has a stockpile of mosquito repellent that can be mobilized and brought to the island and made available. Other interests that we have is obviously our special population, our vulnerable population, our seniors and our children. So working closely with Department of Education on what kind of messages go out to the schools, what the campuses can do, the faculty to help protect the children as well as themselves, and what we can do for our senior centers and other recreation areas around the island and help provide information as well as take care of some issues with the mosquitoes around some of these areas. So we're working together very closely with the Department of Health and supporting them. And again, just want to reassure you that it is everybody working together, and that message, again, we need your help. As you've heard in the information coming out, what you can do at home to eliminate breeding grounds, and the experts will share some strategies and techniques with that, as well as how you can minimize you getting bitten and possibly being the next carrier for the virus. So I'll turn it over to our partners at Department of Health, Jason and Paul, to give you the real down and dirty information about this particular problem. But we'll all be here to answer your questions. And again, please walk away with that message. We need your help going forward so we can eradicate this problem. So thank you.
Thank you, Chief. I gotta say, when I hear Chief's voice, it really calms me down. I think we know, us living on this island, we know that there's just a lot going on this island. If any voice has been kind of leading us through a lot of recent issues, it's Chief. I want to thank Mayor's Office for putting this on, you community members for coming, Councilperson Iligan for being here too. Just to start off too, let's get a sense of this. How many people here have ever traveled internationally? Or how many people would like to travel internationally? How many people here have traveled out of state? Ever? Would like to. How many people here in the last 2 months have traveled outside of your community? Outside of Naalehu? Good, good. Okay, so the reason why I'm saying this, right? Dengue travels, just like us. What you're gonna learn tonight, a little bit about dengue fever, a little about how it's transmitted, but the key thing to think about is this virus travels with us, and it's because of human contact. We're getting bit by the mosquito, it's being infected, it's transferred to another person. That's how it's getting around the world, that's how it's getting around the island, and that's how it's being passed on in this outbreak. So that's something very crucial I want you to remember. And most of all, I want to just remind everybody about fighting the bite. So dengue fever, as since we're staying in this traveling idea, around the world, about 40% of the global population is actually risk. 40% of the global population is at risk. It's endemic in over 100 countries. That means that it's pretty common. It's always present in those islands, in those countries. Here in Hawaii, that's not the case. It's not endemic. That's kind of what we're working towards. We don't want it to get endemic here. Our last outbreak was in 2011 or 2001 on Maui. It spread to a couple islands, and we liked that, and then it went away. That's why it's not endemic here. The risk is we don't want it to be here long term, and it can't, and we're asking for you to step up and help us on these things. So the way dengue fever is transmitted, as I was mentioning, is because of two mosquitoes we have on this island, Aegyptus and albopictus. Both of these mosquitoes can carry dengue fever in addition to several other mosquito-borne diseases. And so the way this is, because it's not endemic here, the idea is that a traveler outside of the state, maybe perhaps even outside the country, brought this in from somewhere else. Local mosquito bites them, goes off to do its thing. Eventually that mosquito comes back and bites another person. So they've transferred pretty much the blood from one person to another, in many ways, and the virus itself is transmitted to person. So there is no person-to-person transmission for dengue fever. The way it's being transferred across the island is, of course, us. As I've said, everyone here has probably traveled across the island or traveled different parts of the island in the last couple of weeks. That's kind of what we're working against. So both of those mosquitoes present across the island. The Aegyptus mosquito actually is only found in the state on the Big Island. The albopictus is found statewide. Sorry, forgot to remind people to turn off their cell phones. But Aegypti likes to primarily bite nighttime, but may also bite during the day. Albopictus will actually prefers to bite during the day. So there is risk, but you're most likely to get bit early in the morning and late in the evening. So what happens is the mosquito bites the infected individual and passes it on. When you've been infected with the virus, within 3 to 7 days, you might start exhibiting some classic symptoms of dengue fever. Those symptoms are sudden onset of fever. Another name for dengue fever is what was originally called broken bone disease. That's because you feel pain in your joints. So that's another symptom you might have. Another symptom is you might have retroorbital pain, so real dark, real hard headache, and you feel it behind your eyes. And you might also see some rashing, primarily on your arms. So if these things present to yourself, what we're recommending everybody to do is, seek medical counsel as quickly as possible. Talk to your doctor, and then they're going to move that on to be confirmed as a confirmed case, if that is the case. So in terms of what the Department of Health has been doing, we have currently, we started our investigation probably about mid-October. We've been following up on cases, and I don't know, I know we don't have it here tonight, but have people been seeing the map that we have at our website? And so, of course, in your area down here, what number was there? What does that number 8 represent? That's right, and I want to be clear about that as well. So that's not to say there's 8 cases in your community. The case count as of 1 p.m. today reported was up to 33. And that number has been steadily rising every day. And we kind of expect that, because there's a lot of cases that we're currently investigating, and we expect that to go up too. Also, as we have these community discussions, we expect that number to increase, because people understand that, well, I might have it, and well, I'm not feeling good, maybe I need to go see a doctor, and then go see a doctor, and you might show some hallmark symptoms. As for those symptoms, a lot of the times you'll have dengue fever described as flu-like symptoms. Now that would be true in some cases, however, flu is a respiratory infection, and so you're going to have a lot of other breathing, nasal type of things. With dengue fever, it's really just that fever, that joint pain, a little bit of rash, and that can definitely lead to more severe consequences, and that's by and far where people get sick. Most of us, even if infected, may be asymptomatic, means we show no symptoms. And that's really smart on the terms of this virus. That's how it's moving across everyone. If it got everybody really sick and debilitated and everybody had to just go and lie down for 1 to 2 weeks, which is what we think what the duration of the most of symptoms are, the disease would not progress. So most of us, even if infected, may not show symptoms, but we still may carry the virus and be able to pass it on to other healthy people. So that's why a lot of our strategy is what you can do for you, your family, your home. These things can kind of guide you along that way. But the best way to think about dengue fever is there is severe counterparts. And I'll go into that now. So we know that there's 4 types of dengue fever. They're pretty much called type 1, type 2. Makes it easy, yeah? Once you've been infected with one type and you recover, you probably will not get that type again, because your immune system has responded. However, you can be still infected by the other 3 forms of dengue fever. And the risk of you having more complications goes up quite a bit, about 15 to 20% on that reinfection with a different type. So those of us that have lived abroad or traveled abroad, or you might have had dengue fever prior, you might be at a higher risk for more complicated symptoms if you've been infected previously. We know that the previous outbreak that was in 2001, actually that was primarily the type 1. And that spread, most of the cases were on Maui, but it did spread to Oahu and Kauai. And so, our own Department of Health response it started as soon as we heard of that suspected case. The way that we respond, we begin an epidemiological investigation to find out where this person was, who they had contact with, and that's why when we saw that map, we know that there's 23 cases as when that map was created, but of those 23, 8 had reported being here. Likewise, some people had reported being at YPO Lookout, some people reported being in Pahoa, but most of all, many people reported being in the Ho'onaunau Beach area. And that's where we're focused on. But as you can see, we love to travel. We love to travel across this island. We're from the Big Island. We go all around. We go to Costco, we go to Hilo, we got aunties and uncles in Kohala. This can follow us wherever we go. So that's why, we need to be vigilant in all of our communities. And it could be present certainly anywhere on this island. So we do have to take, everybody has to do their part. So our investigation, our epidemiological team looks into that, does investigation, finds out where people have been, looks for commonalities across cases. Meanwhile, as soon as we know that there's a suspected case, our environmental health and vector control team are mobilized. The idea is that they go out, do a community survey within 200 yards of the residents. But the idea is 200 yards is not arbitrary. The idea is that, most mosquitoes of this nature that we have here can't fly farther than that radius. So the idea is that there's this kind of hot zone around where the suspected case, and we use their residence as that reference point, but obviously none of us just stay home. We go to work, we visit relatives. So even then we have to go, assess those situations, assess those environments. So we're constantly, this investigation is not easy. Not only that, if I asked any of you individuals where you were 2 weeks ago, at what time of the day, and where you visited, there's a lot of that recall and a lot of that recall bias, which is going to make it really difficult for us to really tag down where it is. So that's just the challenges of it. So instead of waiting for a confirmatory case, as soon as we know it's acceptable, we're making every effort to go out to the property, do this, and that's where the vector control can also come in and start doing spraying. Spraying is, certainly one strategy out of the many that we have. It's effective in killing adult mosquitoes. There's a lot, however, that homeowners can do, and that's this fight the bite thing that can do. So during that community surveillance type of response, our environmental team is kind of going through two individual properties and asking the individual, hey, let's walk around your yard. Look at that old kiddie pool. Do we need water in that? Your grandkids haven't come over for like a couple months. It's just open. Mosquitoes especially both of these species like to stay near us because they want to feed on us, and they like to lay their eggs, of course, in standing water. So it's very important that you take strategies in your own personal environment to minimize the risk for you. That's about it. We're going to have a question session. I'm going to bring up my colleague Paul to talk a little bit more about the Fight the Bite campaign.
All right, hello. How do you do? You did all right, huh? That was with no notes. All right, so Fight the Bite. This is we're going to really try and, push this message to the point where you're saying it in your sleep, right? Fight the bite. This is really how we're going to beat this disease, this outbreak. It basically is by you folks, the community, coming together, neighbors, talking to neighbors, making sure that you do things like eliminate standing water in buckets and puddles, fix leaky faucets and outdoor hoses that are dripping water, right? All these things can create puddles that give the mosquitoes, the daytime mosquitoes that we're concerned with, the two species, an opportunity to breed, right? And then if they breed and they're present in large numbers, which usually if you have large numbers of these, that means there's a breeding source nearby, then they have an opportunity to bite you and potentially continue to spread the infection. So again, you want to make sure that you can get rid of all standing water. It could be in tires. Maybe you have some outdoor potted plants with some water trays. You want to empty those out at least weekly. Either that, in terms of some plants like the bromeliad, if anyone doesn't know what those are, they're all over the island, right? And I know that like dragon fruit's a big thing out here and stuff like that, down in Naalehu and Ka'u. Well, you can see there's plenty of space in these to collect water. So, and obviously you're not gonna be able to rip this out of the ground and dump it, but you can certainly go around and spray it with various products that you can either get at your local ACE, and or you can get right out of your kitchen sink. About 6 ounces, and correct me if I'm wrong on this, Dr. Pang, but about 6 ounces of liquid dish soap per gallon of water. You can make that mixture and go out and spray it in all these kinds of plants every 3 to 4 days. And that'll take care of your mosquito problem right there. All right? If you can't, that's assuming you can't dump it. If you've got a tire or an old kiddie pool or maybe your kid's little tiny dump truck sitting out there in the yard and it's got a puddle in it, that's enough for a mosquito. They don't need a big swimming-sized pool for humans. So just make sure all that kind of stuff around your house, you just check, and the further away from your house you can create a perimeter that is essentially standing water free, the better, more of a buffer zone you have for yourselves. However, again, it gets to the neighbors. If you, drop napalm on your yard, completely level everything, there's no possibility for any standing water to accumulate, but then your neighbors are living in a jungle, 200-yard radius, but they're 50 yards away. Well, and it's not that you don't want to. Remember Aloha, right? We're in the Aloha state. So we want this to be about building community and community coming together around it, not, having neighbors getting in each other's throats because they left a tire out in their yard or something. We want it to be a positive thing. So cleaning gutters, this can be a difficult one, especially if you're kapuna. Maybe you're not comfortable getting up on that second story gutter to clean. Maybe there's a younger kid in the neighborhood that's willing to climb the ladder and just pull out those leaves or whatever may be in there. Disposable tires, and then protect yourself. This is key. If you don't get bit, you can't infect a mosquito. You can't transmit the mosquito potentially if you have dengue already. And if you don't and the mosquito has it, then you can't become infected. So don't get bit, right? How to not do that is go out with, we recommend, Department of Health, County Civil Defense, recommends going out, recommends wearing light-colored clothes. These mosquitoes tend to like dark places. So that's why they'll bite you in the morning, they'll bite you in the evening, then they go find a shady spot and hang out. So you want to go outside. If you're going to go outside and potentially be exposed to biting mosquitoes, then you want to wear long sleeve clothing, so long sleeve shirt, long sleeve pants, shoes and socks if can, and then spray 20 to 30% DEET on any exposed skin and reapply as necessary. If you're getting bit, then maybe you need to reapply a bit, but really you want to follow the instructions on any of the bug spray that you're utilizing. And the other thing, basically, I guess the bottom one here, avoid activities in areas with lots of mosquitoes and try to limit, going outside in the early morning hours and the evening hours when the two mosquitoes we're most concerned about are most active. And that is pretty much it, except if you do, the last thing I'll say on this is if you do feel that you may have been infected, go see your doctor. That's the main thing. Go see your doctor. Okay, and they'll take it from there. Anything, Dr. Pang? And here comes the rock star. This is his thing.
Okay, thank you. Let me just tell you, we're lucky on Maui. We were lucky and we worked hard and we eradicated it. Now, they told us we never would, but we did, so that's fine. God was on our side and we worked hard. But this place is very different than Maui, okay? I know this place. I have a place in Volcano. I come every 7 weeks. I drive through the Southern Pass, and I've been in your area going house to house looking very carefully. You are different than Maui, and that's the problem I want to really talk about. You're going to say, stop scaring us, quit alarming us. No, I kind of have to do that. Paul and Jason talked about preventing. Suppose you can't prevent. Suppose you get dengue. All right, the first time you get dengue, it's kind of like the flu without the head cold or the cough. and it passes. 0.1%, 1 out of 1,000 people are going to get kind of severe and have to go to the hospital. And that's usually the old folks or the very young folks. So in Maui, we had 97 cases, and one woman, 75 years old, had to go to hospital, but she didn't die. Fine. That's the first time you get dengue. And I remember Joe Moore from Channel 2 saying, dengue, isn't that like the flu? That was the greatest disservice we ever had. When you get dengue the second or third or fourth time, the chance of complications goes up to 15% to 20%. If you do not take care of those complications, respond early, the chance of dying is very high. In fact, at lunch today, I was wandering around your community. This guy from the Philippines said, oh, yeah, my niece, she got dengue in the Philippines and she died. Well, obviously, Philippines is so hot for dengue, that's a second, third, or fourth infection. But it's kind of sad. I didn't mean to make him feel bad. But he said, when we went to the hospital, the doctor said, too late. Wait a minute. What does too late mean? You mean if you had done something earlier, we could have saved it? Absolutely. The death from dengue used to be very high. But in the 1990s, a pamphlet came out of Thailand. I was there in Thailand, about how to detect the severity, get them to the hospital early, and treat them all so that you could drop the death rate to almost zero. Well, how come we had to wait till the 90s? Why didn't you see this ahead of time? You know why? Because dengue has increased 15-fold, not 15%, 15-fold in the last 20 years. Hey, you think other people aren't trying to control it? And they can't. So with this massive amount of infection, reinfection, and all that stuff, you're going to see severe cases, and the docs have started to kind of say, well, okay, everybody's going to get dengue. Can we just keep them from dying? So here's the point. If you get dengue second, third, or fourth time, you kind of really going to, 15 or 20% going to have severe problems. Who's that? Any immigrant. I can tell you the Philippines is hot for dengue. If you're here, I mean, I'm glad you're here, but you probably had dengue over there. If you were born here and visit your family, you probably got it if you stayed more than a month there. Any Latin country now has dengue. I watched it move in. I was in Brazil. It moved into South America in 1995. It's all over South America. Any Latin country and any Pacific Islanders. Okay? So if you're from there or you visit there a lot, you kind of had dengue. Dr. Cregan, okay, Richard, he was here in 1990, mid-90s. He said he saw a big outbreak in Hawaii that we kind of think was dengue. We didn't look very carefully, but last night at the town meeting, somebody said, oh yeah, we looked at that, that was dengue. So dengue has been here before. If you lived here since the 1990s, you could have the second infection. So what's the point? It's so bad, what are we going to do? When you first get it, the second, third, or fourth, or the first infection, you're going to get the fever, you're going to get the headache, and you're going to get aches, okay? These achy stuff. And then the fever goes away. It depends on you. It might go away in 4 days or 5 days. And usually it's the mothers. Thank God the mothers are there watching the sick guy. Hey, last time we had a father take care of the wife. Oh, it's terrible. The mother will say, oh, look, the kid had fever, or the father had fever for 4 days. Let him rest. After the fever goes away, there's a period of 2 days where you're very susceptible to the complications. Okay? If you can make it through those 2 days, usually you got to go to hospital. There's nothing fancy they do. They give you fluids so you don't die, just fluids, and then you fix yourself after 2 days. But you got to make it through those 2 days. Well, how do you know he's going into this bad stage? There's two kinds of complications. They have the same kind of treatment. One is called dengue hemorrhagic fever. Hemorrhage means to bleed. So the kid had fever. Well, he gets a chance to rest, poor kid. And then about the fever goes away, he kind of feels better, but he stops to bleed. In fact, we had this last night, right? at the middle of our town meeting, we had somebody diagnosed with dengue who said, "Whoa, gee, they got bloody nose." That's alarming. If I saw somebody bleeding and I said, "Wow, that guy had dengue," I would take him in. That's an emergency. You got to treat that. But at least they're bleeding, so you can say, "Get on it." The other form is called dengue shock syndrome. They don't bleed. They leak fluid into their spaces. You can't see it. They don't leak it into their lung. They don't leak it. They just leak it all over, and essentially you go into shock. That's like severe shock. You got like 2 hours to treat that, or there's a high chance of death. Okay, I can pick up the bleeding. How in the world do I pick up shock? The kid's trying to rest, leave him alone. You or somebody has to wake the kid up. He doesn't have to stay up. Just wake him up every 6 hours to say, "Are you okay?" If there's any mental status change, shock will present as mental status change, either restless, bizarre stuff, or very lethargic and dopey. That's shock. You got 2 hours to get him to the emergency room. Now, if you don't believe me, we had a guy with second infection, Samoan here. They picked him up late. We get tons of guys in the Philippines, and the doc says, "Yeah, you brought him in too late." Hey, man, I thought we had community training. I thought the mothers were on top of this. The mothers are on top of this. You should have seen before we had the training. But you're going to be on top of this. So once again, when the fever goes away and you think, time to rest, no. For the next 2.5 days, wake them up every 6 hours. Make sure they're with the program. The other thing with shock, if you touch them, they're cold. Okay, but yeah, my hands are not good at that. But if they're a little off in the head, time to go. Okay? Now, technically, we're prepping all the docs. Time to receive them. You know what to do, right? Okay. And then they fix themselves in 2 days, and everything's okay. Okay? But you got to pick them up. Now, why am I telling you? If you say, "Well, gee, I never had dengue," guaranteed that. Because you got friends. You're head of a community board. Somebody going to call you in the middle of the night to say, "You went to that meeting. Help us. What's going on?" So you got to kind of take the message further. And we will offer, besides these general meetings, into all the minority groups, the Hispanics, the South Pacific Islanders, the Filipinos. We will come with translations. We will come because you got to watch that group. And you got to watch them. They're your neighbors, okay? And in fact, they probably call you because you know what to do. So I'm just kind of, I don't want to alarm people, but you're in a different game now. By the way, I had dengue before. Hey. So my wife said, hey, if you catch dengue again out here, first of all, I'm supposed to wear brightly colored clothes. She goes, "Wear this Sig Zane." So I said, "Okay, I'm going Sig Zane. Where's the long sleeve? No more for you." She said, "I'll catch you. If you get dengue again, I'll kill you. Never mind about dying from dengue." So she gives me all this repellent. I put on the repellent, and lo and behold, in the afternoon, I seem to have like bites. So if you don't see me, it's not because I died of dengue, it's because my wife killed me. Thank you.